Hi, welcome back to The Patient Coach. This is Jennifer here again and Sophie, and we're going to just go through a number of videos looking at resistance training and just trying to explain how simple it can be. So resistance training or strength training is really important for bone and muscle health as we get older, and it significantly contributes to quality of life, especially in older people. Resistance training is something that people often find difficult to do because they imagine that you'd have to be in the gym lifting massive weights, but that's not the case at all. In fact, once your muscle is moving against any resistance, it will constitute a resistance training exercise. So Sophie here is going to explain a little bit about some tips before you get going on your resistance training program.
So if you are someone who has had a fall before or a near fall, or if you're someone who currently has an injury or has recently had an injury, then it's always good to consult with your doctor or with your physio before starting any new exercise program. So the term engage your core or activate your core is something that's really widely used in exercise programs. But what does it actually mean? So we're going to explain the term now because it is a term that we'll be using throughout our videos. So engage or activate your core essentially means that you're tensing the muscles in your stomach, and how you can achieve this is imagine you're squeezing the muscles in your stomach and that you're also pushing out against your belt or against your waistband. And while you're doing this, you should feel some pressure in your stomach and you should feel as if the muscles in your stomach are tight. Another good tip for achieving this is if you're doing exercises on the floor, lying on your back, imagine that you're trying to press the back of your waistband into the floor, and this will help you to tense your stomach muscles. So activating your core or tensing your core is really important to keep your spine neutral while you're exercising, and it can also prevent overuse of the lower back muscles. So it's quite common that people would overuse their lower back muscles while they're exercising, but by activating the core, we can help to even out use of the muscles and to help prevent injury while exercising.
And then there's just one or two other tips that we're going to explain before we get going with the exercise. So often when people start any exercise program, but especially a resistance or strength training program, they will experience what's referred to as delayed onset muscle soreness. Now, often when you experience this feeling, you would probably think, well, that means the exercise is working. And that probably is the truth, because when you're doing resistance training, how you build the muscle is the muscle tears a little bit and then it repairs itself following the exercise, and that's how you build muscle strength. So if you do experience a lot of delayed onset muscle soreness, you probably should wait until it settles before exercising that particular muscle group again. So a tip might be to alternate between upper and lower body resistance exercises just to try to minimize the chance of this. If it continues, you should probably see your GP at some point. There aren't really any medical reasons that you shouldn't be able to engage in a resistance training program. But if you do have poorly controlled blood pressure or diabetes, it might be worth having those checked with your GP before you start. And if you suffer from something like arthritis or a lot of joint pain and it is worsened by the exercise, this will be another reason to hold off before you seek medical attention. So best of luck, and I hope you enjoy our videos.